So a few minutes ago, I talked about where there is strong, modest, and somewhat weak, or rather I should say minimal evidence for the therapeutic use of psilocybin to treat various disorders. And across the board, it really appears that major depression and so-called intractable depression in some cases is where we're seeing the most exciting research to date. Now, keep in mind that because of the Controlled Substances Act being invoked in 1970 in the United States, and because it was only just a few years ago, really, only about 5 years ago, that psychedelics, including psilocybin, received what's called breakthrough status at the FDA, that there are now a lot of clinical trials exploring how psilocybin can impact various things like mood disorders, addictive disorders, and so on. Prior to 2018, when that therapeutic breakthrough potential was established in the United States, I think a lot of people in the so-called psychedelics community had the sense and the belief that these drugs had enormous potential, but they just weren't being explored that extensively. So I do want to give a nod to the incredible researchers such as Robin Carhart-Harris, but also Matthew Johnson, Roland Griffiths, Nolan Williams, and many others. Okay, I'm certainly not listing off everybody. That would take hours, but those researchers have really pioneered both the legal efforts and the funding efforts, and most importantly, the research efforts defining the clinical data that I'm about to describe. And here I'm going to summarize the clinical data in a bit of a top contour fashion, just giving you the kind of highlights. We will, of course, provide links to the papers if you'd like to look into it further. But I'm only giving you the top contour because I've had the great fortune of having Matthew Johnson on this podcast before. You can find that episode at hubermanlab.com. Just simply put Matt's name or psychedelics into the search function. It'll take you to that episode in all formats, or links to all formats, rather. I've also had the great fortune of sitting down recently with Dr. Robin Carhart-Harris to talk about his work at University of California, San Francisco on psilocybin, LSD, ayahuasca, and DMT as it relates to depression and other disorders. And that episode, which also will be released at hubermanlab.com and on all platforms, YouTube, Apple, Spotify, really goes in depth into these clinical studies and what those studies really look like. You know, who's in the room, whether or not people just get one dose or two doses, how far apart those are separated. All of that is covered in extensive detail in that what I found to be wonderful discussion with Dr. Robin Carhart-Harris. So if you're interested in all of the details as it relates to clinical application of psychedelics, stay tuned for that episode soon. Again, you can find that at hubermanlab.com and on all platforms. In the meantime, I would be remiss if I didn't include a bit of discussion about what has been observed in terms of using psilocybin journeys as a way to treat depression, because the data are just so exciting. Again, these data really started to surface as the consequence of studies that were initiated around 2006 in just a few select laboratories, and then really picked up in terms of the number of laboratories and number of studies between 2018 and now. So what you'll notice is that most of the papers I'm about to describe were published in, for instance, phenomenal journals, New England Journal of Medicine in 2021, New England Journal of Medicine, November 2022, Journal of the American Medical Association Psychiatry, just very recently, 2021. So these are very recent papers. Essentially, all of these clinical studies involve either one or two psilocybin sessions. The dosages that were explored range from 0 milligrams, so placebo, if you will, 10 milligrams, in some cases 25 milligrams, in some cases 30 milligrams. And most typically, people received the same dosage for both sessions, if indeed they did both sessions. However, there's at least one study looking at just one single episode of psilocybin administration. So this is the paper entitled, no surprise, Single Dose Psilocybin for Treatment-Resistant Episode of Major Depression. This was published in the New England Journal of Medicine in November of 2022. I'll just summarize the results of this single application study. They randomly assigned subjects who had treatment-resistant depression, so they'd resisted treatment to other things, to receive a single dose of a synthetic formulation of psilocybin. So they're not eating mushrooms, they're getting a synthetic dose of psilocybin, but the dose is known, of either 25 milligrams, 10 milligrams, or 1 milligram, which was the control. And they received psychological support. There were a number of different tests, subjective tests of depression, taken before and after the psilocybin journey. They had about 75 to 79 participants in each group, again at the 3 different doses, 25, 10, or 1 milligram. And they looked at the changes in these scores, these depression-related scores on these tests. There are many results from this paper one could summarize, but among the most important results I can summarize from the discussion, and here I'm paraphrasing, that the change in baseline levels of depression, that is, at week 3, following the psilocybin session, was significantly better. That is, people experienced more relief, or more people experienced more relief from the 25 milligram dose than from the 1 milligram dose. And, this is important, there was no significant difference between the 10 milligram dose and the 1 milligram dose. This really points to the fact that the 25 to 30 milligram dose that's used in the largest numbers of studies exploring treatment-resistant depression really seems to be, I don't want to say the best dose, but the most effective dose, at least in this clinical context, in this setting, and with this particular patient population. So we want to be careful to say that so that one doesn't just translate that 25 milligrams is better than 10 milligrams, although in this study it was for sake of treatment-resistant depression relief. There were a number of other key aspects of this paper, in particular, the exploration of so-called adverse events, so things like headaches, propensity for self-harm, actual self-harm, anxiety, and so on. It's worth mentioning that there were adverse events in essentially every group. The number of adverse events was highest in the 25 milligram dose group. And this is observed in other studies as well. With higher dosages, there tends to be greater relief from depressive symptoms, but also a greater chance for adverse events. Some of those adverse events can be quite severe, so feelings of suicidal ideation, etc. Some of them one could consider a little less severe, mild headache, or severe headache that was transient, or anxiety that was transient. Again, highly individual responses. We could go line by line and table by table through this paper, which we won't because there's a lot of data. Again, we'll provide a link to this paper if you'd like to peruse it yourself. It's fairly straightforward to read. That's one thing that's nice about these clinical trials is they tend to be written in fairly non-technical language, although there's a little bit of technical language. The important point is that a single dose of 25 milligrams of psilocybin provided significant relief from treatment-resistant depression in this particular patient population. But it is not the case that 100% of the people who took 25 milligrams of psilocybin experienced that relief. However, the majority of them did. Now, when you say majority in science, you really need to look to numbers. And the reason I'm not telling you, oh, it was 75% or 60% or 50% is because it depends on which time point people were analyzed. People were asked about their level of depression relief immediately after, 1 week after, 2 weeks after, 3 weeks after. And the degree of relief tended to change over time. In fact, it tended to diminish over time, but it was also stable, or remarkably stable, I should say, at least by my read, in the 25 milligram dose group. And that is summarized nicely in figure 2 of the paper, because they explored these people's levels of depression out to week 12, and they still saw a significant degree of depression relief 12 weeks after the single 25 milligram psilocybin dose session.